As a parent with living experience, as a former board member and chair of PCMH, as a mental health advocate, and as a parent who received much benefit from PCMH, I just want to say happy 30th birthday, PCMH. What a journey you have been on.
Congratulations, PCMH, on 30 years of helping and strengthening families across Ontario.
In 1994, a group of parents in Toronto identified the need for supports for parents and caregivers of children and youth diagnosed with mental illness. This identified need grew into a grassroots organization known as Parents for Children's Mental Health. When we look back over the last 30 years, PCMH has truly been a leader for the voices of parents and caregivers in the child and youth mental health system.
It originally was seen as a place where families would gather and support each other, and its primary focus was an annual conference. And I think from there, the vision kind of grew that instead of it just being a once a year type event, we should be able to create this environment for families. When the board recognized the power of people, it was a really significant decision for them to move from a completely voluntary-based organization to employing somebody full-time who could devote their energy, their time to building relationships both with families and with system. And I think that was like the genesis of a big change.
They have participated in government committees like the Standing Committee on Mental Health, Moving on Mental Health. They have been part of committees and work with School Mental Health Ontario. They've been part of committees and work with the Mental Health Commission of Canada, and the list goes on. One of the fundamental shifts, or where I saw the needle move when it came to family engagement in the child and youth mental health system, happened back in 2011 when the decision was made to create a training to family engagement. Families were seen for their expertise as much as service providers were seen for theirs.
In doing so, we brought together families to help co-create, develop the training, share their stories, come up with activities and discussion topics, and even come together and present and facilitate that training to organizations across Ontario.
I don't think that we could possibly sit here and say that PCMH has achieved the successes that it has without the successful partnerships, and without some of those partnerships really believing in and taking a chance on families. And really some of the early work that I reflect on is with the Knowledge Institute, the then Center of Excellence, really believing in the power and the voice of what families were saying.
After the development of the family engagement training, it became very clear that we needed to move forward, which really came into building the tools and resources that organizations need to help bring this to life. And from that came implementation models, readiness assessments, tools, and quality standards.
In 2020, PCMH became a part of the CMHO family.
Personally, and my favorite part about joining CMHO was the networking and the meeting with other PCMH peer facilitators and peer support leaders, because what's available in my community is not the same as what's available in another community. And as an advocate for my daughter, I didn't know what I didn't know to ask for. And one of the best parts about being part of CMHO is they take that feedback from us, what is lacking in certain communities, what does one community do really well, and they continue to push for that to be more the norm in all communities in Ontario. So I love that, and I love that whenever we bring them feedback, they really do work to give us resources to support whatever those needs are. So you need sibling support resources, we will work on that. Adore that.
Having PCMH step in and kind of wrap their arms around us has really helped us grow as people, as caregivers, with the training, with the support, with the check-ins. All of that has really impacted how we can now more formally support caregivers in our communities. Just having that PCMH backup for us has been priceless. Honestly, we can't say it enough. Just to have an agency to say, we've got you, like, we're going to make this happen, and what can we do to do that alongside you? The caregivers we have now, who are part of our peer support, have come together, and just seeing the impact of being able to gather. And so that's what we've been hearing from caregivers, is it's just so nice to come and just know that no matter how different our journeys are, there's still a similarity, that we're all struggling at the end of the day, and that we need people who get it.
It's been great to see the growth, seeing peer support groups pop up across Ontario, seeing the shift that we have made in terms of family engagement, seeing all of the tools, the resources, the educational webinars that are now available to families that never would have been available before. I would love to see a peer-to-peer support group in every children's mental health agency. We know the importance of peer-to-peer support. We have evidence and tools and trainings on family engagement and the importance of family engagement in organizations. But what I don't see is any dedicated funding to positions to support these.
I think it is also a demonstration of the power of being so singularly driven and driven by a passion. And there is nothing more powerful than the love and the drive to make your child's future better. And that is the entirety of what PCMH is founded in, and everybody who's involved in PCMH. It is about the singular passion and dedication to their children and youth, the singular passion and dedication to not wanting families to struggle. And I think that that's what's beautiful about PCMH. It doesn't have a whole bunch of competing activities and a whole bunch of competing priorities. The singular priority is creating a future that really works for our children and youth, and driving it with the passion that I feel like only families can bring.
It takes a lot of people, it takes a lot of volunteers, it takes a lot of dedication, and I think that's what sets PCMH apart from so many other organizations, is the dedicated volunteers and the people, the families behind all of the work that they do.
Thank you so much. You have truly made a difference in the lives of so many people, and I can't wait to see what happens in the next 30 years for PCMH.
The impact PCMH has had on my life is incredible, and this work means so much because it matters to so many people. Thank you.